Welcome back to our deep dive on fluids and electrolytes. This is part 2 of the series, where we'll build on what we've already covered and explore key concepts that matter for exams like the NCLEX, MOH, and DHA. Let's get started and strengthen our understanding together. By the end of this session, students will be able to explain what fluid movement is and why it matters. They'll also learn to spot the signs of dehydration, a crucial skill for health and science alike. And, importantly, they'll be prepared to tackle exam questions on these topics with confidence. These learning objectives set the stage for everything we'll cover today. Our bodies are mostly water. About 70% is inside our cells, known as intracellular fluid. The other 30% is outside the cells, called extracellular fluid. This extracellular fluid breaks down further into 3 compartments: intravascular, interstitial, and transcellular. For the NCLEX, it's crucial to understand where fluid moves between these spaces, because shifts can impact everything from blood pressure to cell function. Let's keep this distribution in mind as we explore fluid balance. Diffusion is all about movement from where there's more to where there's less, from high concentration to low. Think about oxygen in your lungs. It moves from the alveoli, where oxygen is plentiful, into the blood, where there's less. This process happens naturally, without any extra energy. It's a simple, elegant way our bodies keep things balanced, letting oxygen flow exactly where it's needed. Osmosis is the process where water moves through a semi-permeable membrane, heading toward the area with a higher concentration of solute. A handy way to remember this is, water follows salt. It's a simple idea, but it's fundamental to how cells regulate their internal environment and maintain balance. Understanding osmosis helps us grasp many biological and chemical processes that keep living things functioning. Let's talk about how fluid moves through our capillaries. It's all about pressure. At the arterial end, the pressure pushes fluid out into the surrounding tissue. Then, as we reach the venous end, the pressure drops and fluid is drawn back in. This push and pull is called filtration, driven by hydrostatic pressure. It's a delicate balance that keeps our tissues nourished and healthy. Understanding this helps us see how our bodies manage fluid flow at the microscopic level. Let's talk about osmolality. It measures how concentrated particles are in a fluid. For normal plasma, that range sits between 270 and 300 milliosmoles per kilogram. It's a key number because it tells us about the balance of water and solutes in the body. Keeping osmolality within this range is crucial for cells to function properly and maintain overall health. Tonicity describes how the concentration of solutes outside a cell compares to the inside. When it's isotonic, there's no net movement of water. The cell stays the same size. In a hypotonic solution, water rushes in, causing the cell to swell. And in a hypertonic solution, water leaves the cell, making it shrink. Understanding these shifts is key to grasping how cells interact with their environment. Let's talk about how our bodies manage fluids. We take in liquids and food, which all contribute to our overall hydration and metabolism. Then, our bodies get rid of excess fluid through several routes. The kidneys filter it out in urine, the lungs release water vapor when we breathe, the skin lets it escape as sweat, and the gastrointestinal tract handles it through digestion. It's a delicate balance, constantly working behind the scenes to keep us in equilibrium. When the body loses too much fluid, we call it fluid volume deficit. The signs are clear: low blood pressure or hypotension and a fast heartbeat, known as tachycardia. You might also feel intense thirst and notice a dry mouth. Another key sign is decreased urine output. These symptoms tell us the body struggling to maintain balance, and they help guide us to the right treatment. When we talk about nursing interventions, there are a few key actions we focus on. Monitoring intake and output helps us keep track of the body's balance. Daily weight checks give us clues about fluid shifts. Managing IV therapy and electrolytes is crucial to maintaining stability. And of course, we always aim to treat the underlying cause, not just the symptoms. These steps work together to support the patient's recovery. Let's look at what happens when a patient receives hypotonic fluid. Simply put, the fluid has a lower concentration of solutes compared to the inside of the cells. So, water moves from the bloodstream into the cells. As a result, the cells swell. This concept is key for understanding fluid balance and is a common question in nursing exams like the NCLEX. It's all about how water shifts to balance concentrations inside and outside the cells. When we need to assess priority in dehydration, two key signs stand out: blood pressure and urine output. These tell us how well the body is maintaining circulation and kidney function under stress. Low blood pressure can signal serious fluid loss, while reduced urine output shows the kidneys are struggling. Focusing on these helps us quickly identify how severe the dehydration is and guides the urgent care decisions we need to make. When a patient shows up with diarrhea and low blood pressure, what's likely going on? The answer is isotonic dehydration. This means the body's lost both water and salt in roughly equal amounts, causing the blood volume to drop and blood pressure to fall. It's a common scenario that can quickly become serious if not recognized and treated. Understanding this helps us respond faster and more effectively to stabilize the patient. Let's talk about the hormone that helps our bodies conserve water. It's called ADH, or antidiuretic hormone. ADH plays a crucial role in regulating how much water our kidneys hold onto, preventing dehydration. When the body senses it needs to save water, ADH signals the kidneys to reabsorb more, reducing urine output. This hormone is essential for maintaining the right balance of fluids, especially when we're thirsty or losing water through sweat. Understanding ADH is key to grasping how our bodies manage hydration. Here's a patient showing signs of vomiting, dry skin, and low urine output. These symptoms point to dehydration. Our nursing priority in this case is clear. We need to restore fluid volume quickly and safely. That means careful assessment, timely interventions, and close monitoring to prevent complications. This case reminds us how vital fluid balance is to overall health and recovery. Here's a key pearl to remember: water always follows salt. Our kidneys play the crucial role of keeping this balance in check. So, when you're assessing a patient, think about fluid shifts first. Understanding this simple principle helps us make sense of complex changes in the body and guides effective treatment decisions. It's a fundamental piece of the puzzle in managing fluid and electrolyte balance. To wrap up, remember that reviewing mechanisms and practicing questions every day really makes a difference. It's about building habits that stick, reinforcing what we learn and spotting where we need to improve. Consistency is key, so keep at it, and you'll see steady progress over time. This video